want to hop on and talk about why the root issue of your injury, especially if you're dealing with pain, why it's not coming from the area that's actually painful. All right. Rarely, so especially like, for example, if you're experiencing like knee pain, rarely ever is it actually due to the root issue, the knee. Usually, really, the knee's just at the mercy of what the hip and the foot is telling it to do, right? And so this is also the reason why a lot of YouTube exercises, like so many of our patients, we ask them like, what have you tried before coming at reaching out to us? And they're like, yeah, I went on YouTube, tried a few different exercises, and went on the internet and looked up like best exercise for knee pain. And what the problem with that is like I said, the issue could be coming from the foot or the hip. But what you're going to do is you're going to get the results on YouTube is just strictly around knee pain. So you're going to get a whole bunch of exercises that are targeting the knee, but that's not really the issue. And sometimes it can actually make things worse. And this is why YouTube exercises and going on the internet isn't as effective as a lot of people think it would be at first, because it's really not addressing the root issue. Okay. And it's also why injuries linger around longer than they have to as well. And it's also why a lot of people fail traditional physical therapy as well. If you guys are a patient of ours, or past patient, or maybe just join the group to learn more, you guys should know that we're not quite the traditional PT clinic. And usually with traditional PT, why a lot of it doesn't work is because they're really just looking at the knee. You might be asking like, Ben, why do they just look at the knee if they went through the same education and went through PT school, and they should know that it's coming from the foot or the hip? Well, the thing is, the physical therapists do know that it's actually coming from the hip or the foot, but their hands are tied because insurance companies will tell them, oh, if the script for that the physician wrote on the script is for knee pain, all they can do is treat the knee. They can't really go at the hip or the ankle or the foot or address the root issue or look at your running mechanics because insurance doesn't deem that medically necessary. And that's not what's on the script. So the clinic won't get reimbursed. So their hands are tied that they can really only treat the knee. Okay. And it's why a lot of people fail. So many people that see us have failed physical therapy before coming and seeing us. Okay. So it can also be like movement patterns that you're doing. Like it could be stemming from the way that you're running. Like you can do all the exercises that you want, but if we don't really narrow down and hone in on what the root issue is with regards to, is it the way that you move with regards to running, is it the way that you're sitting, is the way that you're sleeping, what is the root issue? Because we can do all the treatment that we want, but if we don't narrow down and isolate the issue that's causing this, it's going to keep coming up. Okay. So I want to share a story. The reason I popped on here to talk about this today is actually working with a patient the other day, and they were having some low back pain, and it's been going on for about a month. They were big into weightlifting, and they really couldn't figure out what was going on, and they had seen a couple other practitioners as well. And they're like, yeah, they keep telling over and over again, it's the way that I'm sitting, or it's because my core's weak, and that's why I'm having back pain. And we started diving deeper into because they couldn't isolate what was causing it. And so there's always something that's causing it. And so always the first step that we try and isolate is what is causing this. So did an extensive history of what was causing it, like what seemed to bother him. And we really had to dig deep because he said it was like kind of like inconsistent. Couldn't find like a pattern of or rhyme or reason why this pain would pop up. He said it was like completely random. And so what we did is instead of just like doing like isolated tests on his low back and just isolating that and testing his core, looking at his hips and how his low back was moving, how we do things, we look at everything from top to bottom. Okay. So we're looking at the shoulders, we're looking at the knees, we're looking at the ankles, and thank God we did, because it wasn't coming from his back whatsoever. The reason that he was having this low back pain was actually coming from his shoulders. You're like, you guys probably wonder, like, how the hell does that, how can the shoulders be causing low back pain? And it comes down to what was causing it. We looked at his squat. Everything looked pretty good there. Looked at the way he was deadlifting, looked pretty good there. And we started, and I asked him what he's doing for upper body workouts. He's like, yeah, I do quite a bit of bench press. Looked at that checked out. And then he also said he's doing a lot of shoulder press. And so we just checked that off as well. And I looked at that, and what happened is he was doing shoulder press incorrectly. And the reason he was doing shoulder press incorrectly is because he had He had a lot of shoulder imbalances that were going on, and shoulder restrictions and mobility. And so guess what he was doing during his overhead press or shoulder press, another word for it, is he was significantly arching his back to compensate. So let me show you guys a picture of what I'm talking about here. So hopefully you guys can see my screen. So what he's doing is this isn't the for hip reasons, this is not the exact patient. This is the patient I found on, or this is a picture I found online, but it replicates exactly what he was struggling with. But his low back was compensating for his poor shoulder mobility. So you guys can see, for him to get his arm overhead, he has to significantly arch his low back, because if his back remained flat, the arms he wasn't able to go straight overhead. So what he was doing is he was arching his back significantly and doing overhead press. And what happens, you guys can see, if you arch the back like this, especially if he was a strong guy, I think he was overhead pressing like 135 pounds, somewhere around there, definitely over 100. And so that was increasing the compression of the spine as well in this exaggerated arching position. So the issue wasn't at his back whatsoever. We actually worked on his shoulder. I didn't even touch his back. We did no treatment whatsoever for the back. We strictly looked at the shoulder and worked on restoring mobility and restoring strength, and then also from there reinforcing it from doing that exact same movement. So we just fixed his shoulders, didn't even touch his back, and he's back to working out pain-free and not having this issue whatsoever. And this was something that had been going on for a year. You see how easy this is to identify. Like, this was not, for us, it was not hard, because we take a full body approach, but this just goes to show the importance of making sure that if you are seeing a practitioner, that they are taking a full body approach, not just zoning in on the back because you have back pain, or just zoning in on the knee because you're having knee pain. Can be stemming, most times it's actually stemming from the joint above or below. Okay, so hopefully this made sense for you guys. I know it can be frustrating trying to figure stuff out on your own. So if you guys want us to check it out or have questions, don't hesitate to reach out. But really hope this drives a point home, and this is something you guys have to deal with. So we're here to help. If you guys have any questions, go ahead and feel free to drop those in the comments below. Even if you're watching on replay, I check out the comments periodically, and I can respond back there. If you don't feel comfortable putting questions publicly, feel free to private message me as well, and I'm happy to help. So again, hope you guys found this helpful. If you guys have any other topics or questions that you guys want me to touch on these lives, I'm more than happy to help. Right now, I'm kind of just hopping on as cases come in, and things that we're seeing a lot, because I know there's probably other people that are silently dealing with the same issue. So trying to help you guys out there. But if you guys, like I said, if you guys have more specific topics that you guys want me to touch on, that would be helpful. I'm all ears and happy to help. So have a great rest of your Thursday, guys, and have a great upcoming weekend. All right, bye.